You put me back.
Oh, yeah, yes.
You want me to lay
I'm gonna use this little
lay on the
pad
floor?
right here. No, I'll put you back a little, Donna. There we go.
He wants me.
Yeah, the intelligent mode doesn't catch the glove.
Okay.
That's
Really picks it up really nice.
I want you to on her. Guns.
Yeah, and you can almost get in under the intaglio of that too. I might have it.
Okay.
I'm gonna switch this to the smaller.
Okay.
I don't know if this would be
Sure. Maybe, yeah.
that's really bad if that is helpful at all. It seems like you're getting it.
I'm sorry. Okay.
Yeah.
Mhm.
I need to put that information here. Doing good.
Look at how much it's captured underneath.
Wow, super accurate. Okay, let me see if we catch that.
He freehands aimed that.
Yeah, he did it, yeah.
Yeah.
Because I felt like it was okay.
I don't know if it stays done.
It doesn't feel.
Great.
The bigger one.
Yeah, just to pick that out. I need a stab on this. Sure. Got it, I got it.
Okay.
Yeah, this is perfect.
Great.
Yes, yes.
And then drag him in there.
Nice. Okay. So that you can do her inner pupillary and
Can you retract them for us?
sure.
Thank you.
Christmas pictures.
Yes, right. Christmas card pictures.
Uh-huh.
That's a little closer if you can.
Okay, I'll
Hit the X. Or there you go.
got it.
Yep.
Okay.
Alright. And you can do the proceed. You're gonna do smile selection now. So now you can. There you go.
All right. You can actually select the shape of the teeth from here.
Okay.
The shape you like.
Yes, perfect. Look
Which
at
one?
bigger in the front. Yeah.
I would say,
I like
you tell me.
that or that. If you see the picture of my regular teeth.
Yeah, we can look.
Because they
Yep.
are longer.
Yep.
I like that.
I like this one.
Yeah, that's too short.
I think so too, and I think this one's too narrow for you here as well. That something more like this,
Yeah, or that.
or these two. This is a
Yeah.
little softer. I like Hollywood.
You know, this one.
Yeah, the first
You know.
one.
But tell them you got pictures of my regular teeth.
I'm gonna open.
Because the one went over.
Yep, I'm gonna open up your pictures right now in here.
Oh, that'd be great.
Other images. She had pictures in her that were. There might be in her smart doc now. Weird.
Yeah, that's looking good.
Because her front teeth were bigger, but they weren't real big and long. But the one kind
Can
of
you
crossed over.
find-
But
I don't.
I think we need to come up a little bit.
I know she
probably.
gave them to us, so they're in our email.
Down.
And I
I
actually
thought
wonder if
That's good.
they might
Yeah.
be in here. No.
Yeah, they seem a little low.
Okay.
Let's
Go back.
see.
Yeah, hit the.
Cancel.
Can you see what you can find? Because I know that she emailed them to us. They'd be in our info.
Yeah,
Like
there should
that?
be a little,
Let's see.
there probably should be a little negative space here at the bottom, a little more.
Mm-hmm.
Down.
Up.
Up.
Yeah. And
And move to the right a little bit probably. Let me see.
We have to put.
Yeah, we can start
front
the,
one.
for the yeah.
Yeah, let's go next.
Okay.
I think they need to come up a little more.
Yeah, they're showing a
Oh,
little
more?
too much pink. Yeah.
Yeah. Because it's a relaxed smile, so
Mm-hmm.
there shouldn't be so much gum.
And just go up a smidge. Yep. Mm-hmm. Yeah.
Oh, yeah.
That's definitely.
Yeah.
Yeah.
Hey, this gonna be your smile.
okay, and those are lower, right in the
The
front.
lower's not in there yet. Okay.
No, I'm talking about the front teeth. Are they lower?
Yes.
Or-
they're lower than because you weren't displaying anything before.
Okay.
Yeah.
You know.
So I would say we still stay within these.
Okay.
I would say maybe like a CB4 would
Okay.
be kind of nice. Like, I mean, again, it's got warmth to it. You can hold that up to your, but it's,
Up to my one.
yeah, you can, yeah. I think this is a nice shade to start with.
Yeah, because I don't want real whites. If they look fake.
No, exactly. But this has a, like I said, it has a nice warmth to it. It doesn't have too much of, a grayish hue or anything like that. I think this is good.
Okay.
So
So it's CB4, yeah.
Got it.
Lauren's looking.
Before.
Just before and after, you can let her see her
You
before
sent
and
us
after.
with
Oh yeah,
this,
this is before and after, so it's gonna.
I was gonna look at a lab slip too, because
Okay, as long as the front ones are lower, you know what I'm saying? Oh, I'm gonna look for something. I think it looks okay.
Let me see. I'm looking for those. Do you have those photos that you sent us? Can you look
I'm
at
looking.
Yeah.
Which one?
Got it. Thank
Okay. So I don't want to look. Here's a front view if you need that. But you don't need my sun snap.
Oh, pretty.
you. Very nice.
Okay, I mean, I can make it.
Yeah.
And I'm trying to think what else. Here's another one. Oh, oh that one's kind of old and blurry, but
Basically, when you smile, the front two teeth has to be right on your lower lip.
kind of.
Yeah,
See,
yeah. It's
I
right
can make
there.
that bigger
Okay.
here.
Right. It almost touches the lower
Oh
lip.
yeah, yeah.
That's the length she wants.
And the two.
So we'll pull the impression material out of this and I'll grind for the multi-units.
Yes.
And then we'll take a wash inside of that for a bite. So stabilize it against the MUA comfort caps and then we
Yes.
can go that way.
Yes, please.
Because you haven't done the photogrammetry yet, right? You're just all the other stuff first. Yeah, so we're gonna have to grind all this, take out some impression material out, grind out like spots for each one of the MUAs. So we'll have to like take a little like VPS and
Huh?
That one's gone already.
Mouth.
Cleaning like a little flags.
You say Clorox?
No.
Oh.
Don't swallow it. Yeah, you can take it out, please. Place them like halfway.
Okay.
A little bit tighter, so it stays.
Yep.
But still, we can adjust. That's good. That's good.
Yep.
Yeah, that's
There you go.
Perfect.
Okay.
And then I'll do
You give me what you have in here.
this one for number 7. They should facing each other. Yeah, they should close each other.
Like this.
Yeah, yeah, that's correct.
This one might be a little bit, like you might feel this a little bit more, okay, because it's around the gums.
More down. This way. Yes, that's good.
Okay. All right, they're loose though, they need to be tightened, okay?
Okay.
You might want the shorter one, yeah? Okay,
Okay. From now,
so now,
I will adjust for these. They shouldn't be
Anytime.
touching each other.
you don't want them touching,
No.
okay?
Sound. Okay. I need to tighten this
Yeah,
up a little bit.
nothing is, yeah, I'll tighten them for you.
Okay.
Okay,
Yeah, looks
yeah,
great.
you're good,
Okay.
you're all good,
to
nothing's
go.
touching, okay,
Great.
all right. bit of material, like bite wrench material, and I
wrench.
can put that in
Yep.
to grab
What decides which one goes on where?
the
longer or
size,
shorter?
just size. You need some to not touch, right? But
Yeah.
you need them to be kind of
So-
convergent in the middle.
Right.
So like I put,
The long one
In the interior.
posterior.
so these are for the these are for the lower now,
No,
or
for upper.
upper
I
too.
need to scan
Okay.
that too.
Ah, okay. Do these actually?
You can actually turn it with your.
Oh,
You're
this
the
just
whole
goes.
thing.
This
Right.
is just a
But
one
it's not
piece.
engaging,
Okay,
no?
gotcha. All right. This is like the impression copings. They just spit. These ones just spin on.
So this is a separate scan with those?
Uh-huh.
Yes.
That's what it sounds
Just
like.
to make sure everything
Is-
fits. It's not a one piece.
You have those
can just
stereo
turn.
impression holes for Jeff.
Yes. I wonder if that plastic piece would over there.
Oh, like be more.
Yeah.
Oh, do you think?
I mean, I don't think he's making it work, but. Yeah.
Let me-
Good. No, this. Okay, next. Now we kind of get her lip on this. There, I got it.
Like to go over like a gingerbread.
I know.
Seems like you better-
Yeah, it's the program too.
Thank you.
That's it?
Yeah.
Okay.
Poor jaws.
I'm sorry.
Oh, that's a fake one?
That's the fake one. Yeah. It actually just seats right in it. I don't even know if we need to do anything. She'll be able to bite down in it. With that. Yeah.
Am I hurting you? Okay.
Tissues look pretty good here. Good. More. This is some pretty sophisticated digitalization where we don't have to use all the impression material done for you. It's so nice to have this workflow. It's not been around long. It's pretty cool. And you're the perfect one for it. We have another person in the office here that has 12 implants in his mouth. He's right next door to you, and we can't use it on him. We have to do it the old way.
skins?
Oh, I mean, once we work on the intention,
Much better.
I'm gonna set your top plate in, okay?
Yeah.
Can you bite down, John? Anything else? You just
No,
go with that,
yeah.
right?
Yes,
You
yeah.
probably don't open it. You probably just cut that thing and fit it on there, right? And then try and. We don't like this anterior overjet. I
Right.
think her bite's okay. We gotta fix all that in the
Well,
in the
yes.
in the final. I think she's got she didn't like the way it fills out her face like this and everything, which of course was
And too
will
much pink.
Right.
Way
She
too-
she
she
didn't
needs a
like all
longer
that
tooth.
stuff.
Okay.
Yeah.
Okay, we're gonna move the midline.
Yeah.
Uh-huh.
Yeah. Exactly.
First of all, we're gonna
Decrease
move
the
it,
overjet.
and then
flare.
we're gonna
Exactly.
lengthen it.
I think flare
Just to
the
record the bite,
anterior
yeah.
in lower incisors a little bit, and then bring
Right,
back
right.
the
Okay,
uppers
so we're
to
gonna-
decrease that.
Yeah.
Because from this profile, you can really see it from her side profile. You can
Yeah,
see
yeah,
how
her-
they're
her
almost
teeth-
almost
yeah.
retroclined
Sorry.
down the lower,
Yeah.
Can you take gotta bring
Yeah.
the mandible inside a
Come.
little bit out?
like right, and then I'll help you.
There you go.
Right, that's great.
Yeah.
Yeah.
So
And
we
then
gotta
come
bring the
around. There you go. Yep.
mandible out.
Translocate the whole thing, not necessarily tipping of the upper
Right,
teeth.
right. Whole
you
thing
know,
has to
whole
be
thing.
in.
Yes, right. Just a smidge.
So it's
And then
gotta
the-
flare out, still
Yeah.
flare out,
Yes.
but okay,
Yeah.
I got it.
Yeah, yeah.
Okay, good. Oh, and- now I'm gonna take this one.
Okay. Let me look, I'm gonna get the other
Sorry.
retractor in there.
I know you don't want to go in, but I'll do this.
It's fine. No, I'm good. I just prepped that.
Just give me 1 second.
Sure.
Great. That's it. Wow. Thank you. Thank you for your Great.
Like this.
Okay.
Perfect.
So if you need anything else, call me. Autographs, let me
Yes, we'll
know.
let you know. I think did that.
Okay.
Good.
Oh yeah.
Oh, okay, I was
Because
thinking, sure.
I was thinking something else about the other patient.
Yeah, you can go, you're good if you don't.
Go ahead. Yeah, just walk through the whole process. And then kind of retract a little bit. Can you retract can you actually, yeah.
It's the
She can do it?
Yeah.
the stuff that we use for that cast post. Do you know where that is? Okay. Is that good or?
No, right?
A
That's,
little more.
are you sure?
Because we gotta do gingiva, so we might need.
I can get the retractors.
Let's
You
see.
guys want?
You have there, right?
Yeah. A little. Is that good?
Yes.
Okay.
Okay. Perfect. Okay. You can let go.
Okay.
Yeah, she's good.
Make sure that was removed.
Let's see here. And right here, there you go, tissue color selection. Okay. And, yep. So did you draw around yet, or did I let you draw around? Here, press, yeah. You want, a little bit of tissue color. Okay. And you gotta kind of draw around the tissue. There you go. So here, I'll let you do it. You can relax.
Okay.
Yeah.
I'm like, do
Oh,
I
so
smile? Do
just-
I?
Do it for me. Go ahead. Okay. Now you can select the color. Yeah. There you go. Select the different tabs. There you go. Yeah, probably just ask the doctor.
This? Oh, ask doctor?
Yeah.
Okay.
Yeah, yeah.
All right, let me see him again. Let's see each color again.
Take this.
I'll take this. Um.
I'll try the darker
the
ones.
12th.
Let's see the darker ones.
To be
Okay.
on the safe side, then if it comes back the week before, we'll call you.
I think this one.
Oh, that
Yeah,
sounds good for you.
yeah.
Okay.
Probably just natural. I was thinking like that. Looks, because you're not really going to see it. I'm not going to walk around with, showing my gums. Am I right?
Right.
Yeah.
You
Well,
know.
When you smile big, then it's gonna show.
Yeah, see, but when I smile, usually you don't see the top. Because I had an implant at front that went all the way up to here.